Okay, so many people these days have read about or heard about hip resurfacing, which is a very good technology for the right patient, is a very good solution to severe arthritis of the hip or any degenerative condition of the hip. And basically, I'll show you the difference between this and a total hip replacement, because it's subtle but an important difference. And this is a model of a pelvis and a hip. It's a ball and socket joint. If we take out the ball part, you have what's called the femoral neck and the femoral head. In a traditional hip replacement, the femoral neck is cut, and we place a stem down into the canal, and basically the head sticks up like that, and that then will articulate with the cup side that we've also resurfaced. It's a great operation, has a great track record, and for the vast majority of people is really a good way to go, a great way to go. For certain people that qualify for a hip resurfacing, and that's typically younger people that want to be more active, there's something called a hip resurfacing. And it's a form of a hip replacement, so it is a hip replacement, but it's subtly different. Instead of cutting off the femoral neck, instead of doing that, we can actually just shave down the damaged cartilage and place a cap over the neck. So what that does is that spares the bone and allows for a hip that's more like your own native hip and allows for more activity. One of the problems with any artificial joint, be it a knee or a hip, is that it's a mechanical part, and ultimately they can wear out with time. And that may be 10, 20, 30 years or even more, but ultimately they may wear out. And the good news is, with a hip resurfacing, if it does wear out for whatever reason, you can always go to a hip replacement. You basically have your own femoral neck, so you can cut it off and place a regular total hip in place. And that's one of the reasons why people think, or doctors will allow patients to be much more active with these, because there's always that secondary operation that can be done. A good question is, if hip resurfacing is bone conserving, then why not do that for everybody? And the short answer is that hip resurfacing requires stronger, healthier bone, which is typically seen in younger patients, although some patients that are a little older do have very good, strong bone. And you have to have a very close conversation with your orthopedic surgeon to see if hip resurfacing is right for you.